Okay, there, it says it's recording. Yeah, so this is the fourth one of these that we've had, and this is the one that is a little more generic in general. So I don't really know how to start off the conversation other than just to ask y'all, what are the things y'all have been doing to be in touch with your people? What's been working? What have you struggled with? And just open up the floor. Mary Balfour, you want to share what you were sharing earlier to start us off?
So we've done two things. First of all, I called everybody that I felt was sort of the most vulnerable. I made those phone calls right away. But then we took our directory, which we only have about 200 people. So I know everybody can't do this, but not only, we have the pleasure of having 200 people. And I divided the directory up into 8. So A through B, C, D, and E. And everybody got, a vestry member got one of those and started making phone calls for 2 reasons. The first one is we want to check on everybody and see how they are. But the second one is we want to know who needs stuff and who's willing to do stuff. And then all that information is being filtered back to me. So I'm just coordinator, central right here. And that's what we're doing. So if you're willing to be helpful or can feel like you can get out and it's not going to compromise who you are and your system, then we want to know that. And then if you need help, we want to know that. We've gotten questions like, how do we pay the person if they want to go do our groceries or whatever? And I'm just letting them work that out between themselves, if they want to write them a check or if they want the church to help them or whatever that may be. So that so far has been really successful and really good. And one quick note, I said, we called somebody a little earlier today and they're like, we haven't gotten a phone call from the church in 4 years, not in like a negative light, but just no, they didn't really need or have a reason to be called, I guess. And this is somebody I don't know yet. And they were just so thrilled to get a phone call. And we're thrilled to be a part of this and was willing to help. And so that was, something really positive that came out of it. I think I've said this on every call we've made, but for the people that don't have technology, we're creating a banner and putting it out in front of the church. I've had all the calls to the church routed to my cell phone. So if we're not here, we don't miss anything if we get to a point where we can't be in the office anymore, whatever that is. And so we're putting a banner outside that says contagious in helping, contagious in loving, and contagious in healing. We're here to do all 3. Call this number if you need help. And that's the church's number. And so that helps give the presence of those that usually are kind of knocking on our doors, needing help in our neighborhood, that we're still available to them. I think that's all.
Awesome. I saw Janie and then Suze.
Well, it seems kind of silly, but I have a whole bunch of octogenarians who love to text. And they love to use emojis. And I have figured out pretty quickly that my daily check-in with them, which takes a nanosecond, is really boosting them. So, we all know which ones are the most anxious, the most apt to be, alone. I have one whose wife's in the nursing home and he has to take his phone and go around outside the building and talk to her while she's on the phone through the window. Luckily, he can stand on the ground to do that. But he's bereft and lonesome, and just those little touch-ins are helpful. And we did some of the same things, not the contagious banner, which I love, but we did that with our vestry too, calling people. So that's where we are.
Suze.
Yeah, so I've been working with our leadership to figure out as many ways as possible for people to stay connected when we can't be together. And one of those is, of course, by Zoom meetings like this. And there are just some folks who are really struggling with that technology. So pretty much every day since this weekend. I've been sending out letters, just informing people of what we're doing through constant contact and email, just letting people know what we're doing. Yesterday's letter, I encouraged all of those who had refrained from being on Facebook to give it a try for the time being, and just reminding them that they could always leave when all of this is over. But with the idea that that is one of the easiest ways that we can connect, particularly for our worship service. I've also asked, you know, kind of along the same lines, we've been asking people who has needs and who can help provide those needs. Yesterday's letter also included a request for people to let us know if they're struggling with the technology and those who can help. And so we're trying to match those people up, you know, just to, you know, give a call and see if you can talk somebody through the process of signing on to a Zoom meeting. The video that you guys made, I think has been really helpful in that regard as well, Alan. So I appreciate that a whole lot. But mostly what I'm hearing is, you know, the nightly Compline is really appreciated. People just feel like it's an opportunity to be together when we can't be together. And I'm trying to encourage all of our groups to just figure out ways to get together online right now. So that's primarily what we're doing right now.
Tina, was it you in one of the earlier calls that talked about connecting youth with older folks, or was that someone else? Do you remember that?
No, I mean, we've talked about it in both the other, we've had a few roundtables today. Oh, now my dog's being loud. It's fine. So yes, this has been interesting. It's been an evolving conversation. And as we've crossed all these calls, my dog says hello. One of the things we're looking at is, at least at St. James, is a kind of companion program. So for older folks who are not able to leave the house right now, being able to log in, kind of create a request for that, and then younger, healthy, non-symptomatic people who are willing to be those companions and run those errands and things, to log in and kind of put in a request as well. And we are hoping to be able to pair those people up. So then folks have people like who will call in on them and check on them. And I'm so sorry, I will just call my dog in a minute. The other piece of it was like thinking through like what, actually no, I'm gonna handle that right now.
Yeah, that's the life we're getting used to. Oh, she's coming back? Nope. Okay. But yeah, what she talked about, I love the idea. Your kids haven't actually popped in the screen yet, Jimmy. That's the next step on Zoom bingo. But the idea of connecting youth with older adult, hey, we got a kid. There we go. Everyone mark off that box. Is connecting youth with older adults so that parish leadership, clergy can connect, but also is there a way that our youth group can connect, you know, in ways that are helpful and not forced or, you know, contrived, but to work on intergenerational connection at this time. Okay,
and so sorry about that, guys. She's been really good all morning, and now she's getting antsy. We've been doing a lot of work with like the other things that I've been thinking about too is, you know, so if our older folks are technologically challenged, we can equip young people to like using whatever devices they have, like maybe you know, a young person could set up Zoom on a person's computer so that they can engage in things like this, or maybe they need, you know, help teach a person how to use, like step by step, write it down, how to do a FaceTime call. They're trying to get in touch with their family. How to, you know, like how to help them make a social media account. So if they want to look at a live stream on Facebook or on YouTube, like figuring out how we can connect people with resources and then building that intergenerational relationship through that. Yeah.
Awesome. Thank you. If another quick Zoom
I have a
thing.
question.
Oh, yeah, Sue.
So Tina, when you're talking about having them set up something on their computer, doing that to you in our choir room to teach music lessons, piano lessons, because their regular venue isn't available. And my question was, well, are you going to be able to teach that lesson and stay 6 feet away? And she said, no, I'll make other arrangements. I thought, you're not getting it. You're not getting it. If this is going to work, if we're going through all of this, we have to keep those distances and hygienic practices. So how are you doing that, Tina? Where'd you go?
Well, I mean, we're all building the plane as it flies, right? So that's kind of the land we're all living in right now. And so what I would think through on that is,
as leaders in the church, as formation leaders in this church,
is someone else talking right now?
be able.
Okay. Is Jimmy talking? Okay.
It sounded like Jimmy, but it sounded like background somewhere.
Yeah, I muted it. Go ahead.
Sorry.
It was from someone else.
I was thinking through the idea of, okay, so if we can create, I mean, this may be a case where someone could wanted to wear a mask or gloves or whatever, and like still create some of that social distance, wiping the screen, like if you're, whatever you're touching to be clean. But I think that's a training piece that we would have to do. But I live by myself in my house, and it gets, when you're doing situations like this, it is very strange to be like, if I don't do things like this, I'm not going to have a conversation with another human being in a given day. So it's a both and so that's a good consideration to think about as well, Susan. I appreciate that.
So on Zoom, there's a thing in the toolbar across the bottom that you can open up the chat window if you haven't already. Mary Balfour shared the image that they've used for their banner there to give you ideas of that. If you have other questions or thoughts or resources to share, you can put them in there as well. So what other thoughts? How are people, checking in with everyone? Like Mary Balfour was saying, and others is great. What other types of things are you thinking about? Have you implemented? Rob, looks like you want to speak.
And actually, it's doing much of what you're already talking about. We have fairly large list of folks, and what we did, we divided them initially up by age range. So anyone over the age of 60 would be on the first call list, and then we added medical frailty to it, either pre-existing conditions we know about, or folks that are undergoing chemotherapy right now, or have like a known autoimmune disorder, or are caring for elderly parents, which we have several folks doing. And so we divided those up among our executive committee of our vestry, and then Father Paul and I have been checking on the others. Just as a side note, something that's been interesting is how many of the people that we are concerned about who immediately volunteer to be available to help others. There are people in our neighborhood, and it'll be a neighborhood where there are a lot of retirees, and so-and-so doesn't get out very much, so I want to reach out to her, and I've already gone and gotten groceries for her. So what we're seeing, and I'm sure everybody is seeing some of this, is that our people are already reaching out to help each other and the people around them. From the standpoint of social distancing, they're being careful, but they truly are trying to be, good neighbors. It's also been revealing to us how much inaccurate information we have with phone numbers. A lot of the folks that we have on that list We have their old landline number, and they're no longer using landlines. So about 660 some odd phone numbers, and about 1 in 10, as it turns out, have not been accurate, which was a big surprise for us. But we're not doing anything more different or innovative other than exactly the same kind of things that you're hearing from other folks, and it does seem to be effective. Oh, one thing though. So some of our kids, we tried to operate our food pantry today using some really, really serious precautions with folks, taking a number, going back to their vehicle, coming up when they're called, a prepackaged box being given to them. One of our moms brought her 2 sons to help out in the background, doing things like wiping surfaces down and carrying boxes as a social studies lesson. So they're just sort of surprising ways that folks are making the activities that we do as our parish a part of their sort of new life dealing with this virus.
I had one other thing I forgot to say earlier, which was we've gotten the Daughters of the King to write notes to all the people at Wesley Commons, which is our assisted living place, because they can't even go in the dining room anymore. And I can't go see them. And so, everybody's just wanting to do something. So I thought, writing notes is something we can all do. And I know the youth is doing that too, but that was a way to engage the daughters, if anybody wants to get your daughters to do that.
Suze, yeah.
That brings up a question for me that I have, and I anticipate that there might be a couple of crises forthcoming in the next couple of weeks with some of my folks who are in situations I can't enter. So what are your suggestions for providing pastoral care to them? I mean, I have some thoughts, but they're not particularly pleasing to me.
Yeah. I don't think any thoughts around this is fully formed yet. I did a burial graveside Monday because one of our retired clergy who was supposed to do it lives in a retirement community and doesn't want to leave. And, there's some dioceses that have suspended even pastoral services, burials, weddings, all of that for those. But I mean, how do you do liturgy at the time of death, right? How do you do anointing? I don't know. My mind almost goes to mush when I try to think about it. What are your thoughts that you're trying to form?
Can I real quick?
Oh, go ahead, Christopher.
One of the things that we're doing, I'm actually a hospice chaplain by trade. So I'm interning during a time of epidemic and also being the director of spiritual care. So it's this weird thing. One of the things that you can do is if they're getting like routine home care or something, you can find out I'm having my staff call their families first off, because sometimes when they're in the facilities, they can't always communicate very easily. Hello everyone, I'm Chris, and I'm the intern at St. Michael All Angel. Some background reference. I'm having my chaplains contact the families of the people who are in the facilities and reach out. We're trying to proactively reach out to their community chaplains or their community pastors, because on occasion, not everywhere, but in some of the places, we can actually make visits because we're part of medical staff that many of you cannot. That's not true universally. Some places are locking down everybody but nurses. But it's possible, Suzanne, if you could reach out, maybe if there's a chaplain that lives there, they can kind of step in and fill the need for you. I know at Lee Park Road, there was a chaplain Chaplain Chong, who is a Methodist minister who is basically planted himself with the families that are there. And he's kind of stepping in for everybody right this second. I mean, it's not ideal, but it's a resource that maybe we could use in order to help out. Because I know that at St. Michael and All Angels, I think we're kind of locked out of at least one of the nursing homes right now.
Yeah, and like it Still Hopes. So Still Hopes is the one in Columbia. Their licensed areas, so any of their significant care areas are closed down. And so Rich Crozier there has invited clergy to contact him if there's parishioners there. And I'm sure it's the same at other nursing homes and hospitals in general. Has anyone else experienced that yet with a hospitalization? Aaron?
Well, I can speak to care facilities. I spoke with the activities director at one of our local care facilities and yesterday, and she shared with me that they are on lockdown. Basically, all licensed care facilities in the state are on lockdown per South Carolina DHEC, and that's per CDC recommendations. They are all on lockdown through April 14th, and even DHEC representatives are not allowed to go in. That is how stringent the lockdown is. So it hurts my heart that we can't get to those folks who are already so frail and so lonely and so socially isolated to start with, but that's what the situation is.
One of the thoughts that I've had that isn't particularly satisfying, and I'm not entirely sure how to make it work practically, unless you can get contact information or get a nurse on a phone or something, is to be the voice of the litany at the time of death or ministration at the time of death, and have the nurse be the hands at that point in time. That's about the best I can come up with for that particular service.
Yeah, and I mean, some of this bleeds into what we talked about in the worship call is, what does Eucharist look like in a dispersed way? I mean, what does anointing or any kind of laying on of hands? I mean, these are questions that people haven't grappled with, or at least no one that I've talked to. And so we're doing that here. And if there's questions so you've all, clergy have been invited to the calls with Bishop Waldo tomorrow or Friday. Questions that you think rise to the bishop level, if you haven't already talked to them, that would be a time to bring up some of those things if you're trying to seek bishop's permission for anything.
I wonder if there isn't an opportunity for us to do some learning from, because I know, like, my understanding of the priesthood is that it's always talked about to me as very sacramental. Like, so everything is that's the core of the priesthood, is the sacrament. And so if the sacraments look differently, then that might be a bit of an identity place of contention. And so figuring out, like, if there are other ministers who have been ministering differently because they're in a tradition that isn't as sacramentally oriented, then there may be some places and spaces for us to do some listening to see, okay, if you don't have the tool, if you're not equipped or ordained with tools that are sacramental, like, how are you ministering to people? Like, what are other people doing differently, or how are they being creative too? And because there's a lot of people who are all in this conversation across a lot of different, groups and traditions. It'd be something I'm thinking about.
Yeah, I think in some of those instances right now, there's not going to be the opportunity for clergy to be with people. And so I think what Christopher talked about and what Aaron and others is working with the people who are on site. And I mean, we all know a bunch of nurses, and nurses are by and large willing to do almost anything to help their patients. And if that means, helping a priest get a word to them, they're gonna, because nurses are figuring this out too, right? Medical professionals, all these facilities are figuring these things out as well, right? It's not like they've been holding the playbook hostage. no one knows what we're doing. What are some other thoughts?
Alan.
Yeah, Rob.
Just a question. Do we have any ideas, or do we actually already have any place that has someone that's tested positive? If we do, how is pastoral care being provided to that person and their family?
I don't know of any in the diocese. I don't know if Jimmy's heard of any others, but none of that's been shared with me. I don't believe we do. I talked with Pickett yesterday. They don't in Camden. And if there was a place that would, I would think. Suze, do you know differently?
I'm just going to say that one of the physicians in our parish has been on the front lines here locally, and he and his staff have been exposed to confirmed cases, and so they are self-quarantining. And the parishioner the parishioner has a family with young children, and so he's having to self-quarantine from them as well. So I'm checking in with him and with his family on a regular basis, and trying to keep the family connected to other families who are their primary support anyway, and just doing what I can, just to be present with them.
Yeah, Gary.
So the one thing I was just going to mention is, some of y'all may know my wife is the chair of the Department of OBGYN for Prisma Health System, primarily upstate, but so she's been involved in a lot of management level decisions about what the hospital is doing. But she also has been identified as one of the younger, healthy OBGYNs who will be, they have like 4 or 5 that will be the ones who provide care when a pregnant woman comes in to the Prisma Health System. And that hasn't happened yet, as far as I know. But we are working on trying to figure out how to deal with that as a family, to the extent that she does get exposed at some point, then how we kind of quarantine her from us. So.
What age are your kids, Gary?
3, 6, and I'm sorry. No, they're 6, 9, and 12. So
That'll be hard.
Yeah. We have Casey's father lives here, just recently moved here, and he has a house just a few 5 minutes away from us. And I think the plan is going to be to have that kind of be the quarantine house. And depending on the level of concern, it may be that she goes there and cleans up before she goes home every day, and he stays here, or that she goes and lives there for a little while.
I wanted to say something that's sort of in a positive light, if that's okay, with some of the vestry coming, and I'll be praying for you, Gary, and your family. Some of the vestry that are making these phone calls, they've said, how do you do this every day? This is really hard, talking to all these folks, but I think it is such a good thing for them to get involved and see how important this ministry is pastorally. And my hope and prayer is I've been wanting to engage more people in pastoral care, and maybe this is the way that's going to happen, which is not what anyone would have asked for, but I keep trying to find where God's shining his light over and over and over. So just thought I'd share that.
What else? I don't care to keep people longer than the discussion allows. Any last minute questions, thoughts, concerns? Yeah, Rob.
Yeah, I would just say that when we inevitably get cases, we come back together to share whatever that response is. So we'll have a clue as to what works, or for that matter, just what's problematic.
Yeah, Jimmy and I talked earlier about these ministry calls. You know, so far we've done mission, worship, formation, pastoral care. We'll have a one-off one on Friday, kind of teaching people, refreshing people on leading morning prayer. And then we're working on a stewardship roundtable or webinar next week. But for the ones today, these mission areas, the thought is in 2 weeks, we do them again, right? Don't know that it needs to be weekly, right? Because we got a lot going on. Maybe it does. But to come back and say, hey, I'm now an expert in X, Y, and Z, or now I know this fails. We'll know a lot more in 2 weeks. So that is the plan, unless y'all rebel against us. Dude.
Well, I'm, for one, super grateful for y'all for what you're doing and how you're connecting. I feel like I'm getting to see my bud, Janie, all the time, and, you know, all these folks, and that's awesome. Just to let you know, TENS is doing a stewardship Zoom call. Did y'all see that?
Yeah, I need to share that out. I saw that this morning. Suze.
This is Kate from Clemson. One of the things that we've done locally, we've always had a really good collegial group here of pastors who get together on a monthly basis. We had a call on Monday, and we've scheduled a recurring call each Monday, and a lot of folks have been checking in between times. Just the opportunity to have that conversation about what's going on and the decisions that we are having to make with very little sense of having been here before, and a great sense of unease about some of the decisions that we're making. It has been incredibly helpful to have that connection, and in whatever way that you are able to have that sort of contact with colleagues, whether they're Episcopalians or just the local clergy in your town, I highly recommend it.
Any last minute thoughts? Let me look through the chat. Doesn't look like there's anything there. Yeah, so this is the last one of these we're doing today. The other two are already up on our webpage. Let me, I did this on the other call, so I'll walk y'all through that real quick for anyone that this is their first one. So let me share my screen real quick. You go to our homepage, and if you haven't been there in a day, the first thing that's going to pop up is a pop-up that says public worship's postponed, whatever. You dismiss that. This main page here, you click for resources. We're curating resources in various areas here. So worship and formation, we talked about those in the earlier calls. Technology, helping people get online for meetings or for worship. And then ongoing webinars. And this is where we're going to house all of these. So like the roundtables from earlier are already up there. You can see here, this is where we are all going to go in about 45 minutes. And then the one from Monday. So we'll keep that updated with different things. We'll have the one on Friday about leading morning prayer. And then we'll have one next week at some point about stewardship. And I've said this on the previous calls, and I think it's important to reiterate. Some of y'all have heard it before, but we're in this for the long haul. I don't think the CDC knows when this whole thing's going to quiet down. And so there's a lot to do at first, but there's going to be a lot to do for a long time. And so pace yourselves. I pulled some quotes out of the recesses of my brain for statistics from Episcopal Relief and Development about clergy turnover after disasters. I had said that 30 to 40% is what I thought it was. I went back over lunch and looked up, and it's more like 75% to almost complete turnover within 2 to 5 years after disaster scenarios at congregations. My parish in Houston, both of the clergy that are there are now in New Calls. And so that's real, right? We're going through something that's kind of unprecedented, and there's a healthy number of folks that are no longer in ordained or in, ministerial roles after disasters. And so pace yourself, figure out how you can provide pastoral care for your people, but also figure out how you're going to, structure your time and give yourself some Sabbath and some breathing room so that you can do it months from now if necessary. And it looks like the good Father Rob wants to add something.
No, I would just point out that no matter where you go, if you take a new parish, you're walking into a place that's just been through it. So it's not like, leaving New Orleans after Katrina and going to Oklahoma. I mean,
Yeah, and so this is a whole new
we're all
reality,
going
right?
to-
Like I could escape to the sunny confines of Columbia, South Carolina to get away from a flood.
Yeah, how'd that work out for you, Sparky?
Good times. But none of us can escape this, right? Dan, did you raise your hand? Did you want to say something?
My question was, once you looked at that data again, I was curious, what was the percentage of the clergy involved with disasters that just left the church?
Yeah, I didn't see that. What I remember is it's a quarter to more. Like it's a healthy number. I mean, people who leave the ministry within about 7 years is high anyway in general, but for folks who are involved in high stress situations, and those are acute disasters, and dealing with a flood or something is one thing. Those are over, acutely, and then they have a long tail. This, we don't know how long the acute portion is going to be, frankly. We can't even think about the long tail portion yet. Please take care of yourself. Please take care of your people and other folks that you're recruiting into ministry, so that when we're having one of these calls 3 months from now, God willing, we're not, but that we don't all look super disheveled. Yeah, Suze.
Suze Kate at Clemson again. This time last year, we had bats in the nave, and I would go back to that any day.
You baptized it, right? And it left? Is that how that went?
Gave him a pledge card.
That'll do it too.
Yeah. That sounds like a great place to end this, is getting bats to pledge. But that's part of the long tail that we're going to have to deal with, is the stewardship piece. And so I've got the links to the TENS stewardship webinars, and I'll get those out to the clergy today, hopefully. We'll have our diocesan webinar on that, and then we'll keep these going. So probably not next Wednesday, but the Wednesday after, we'll have a day long of these that you can hop on the ones you want to, just as a check-in and to see what's working. But otherwise, I appreciate your time. I appreciate y'all's ministry, and keep fighting the good fight.
Thank you, guys.
Thank y'all.
Thanks, Alan.
Bye, y'all.
Bye.